Hey everyone, welcome back to Wisconsin Family. We are here at Crazy Lenny's e-bikes. We'll be back with him in a little bit to update you on how the race went and how the votes came in, if you saw last week's episode. So
it was a close one.
It was a close one. It was
held your
very
own.
close.
Yeah.
I did, so barely. But before we get to that, we talking about exerting yourself. I didn't strain a muscle during the race, but if I had, I know someone that could have been able to help me. Kevin Waite from Capital Physical Therapy. Thank you for being here.
Thanks for having me. Appreciate it.
For sure. So tell me this. Actually, we're going to get right into some things that are pretty specific. There were some federal guidelines that came out in relation to exercise and physical therapy. Get us caught up on that and let us know what that's all about.
Yeah, so just last week they published the new guidelines. They do it every 10 years. They get researchers from 20-some different universities around the country to give us Americans guidelines on how much we should be moving, exercising throughout the week. So they kept it actually the same as 2008. We're supposed to get about 150 minutes of physical activity every week. That's harder to do in the winter time, which we'll talk about.
Yeah.
But the thing that they added is actually now you need 2 days of resistance training also. So you need to get more exercise, not only just walking and being active, but actually moving against a resistance with the goal of trying to get your muscles tired. They found that that's really good for bone health and muscle health.
Does carrying your kids up the stairs count? Because I do that
Depends
regularly.
on how large your kid is, but
oh,
it
shoot,
could.
they're still little. Well, let's talk a little bit about specific to winter injuries. You said getting exercise in the winter can be tougher, but one of the things that I think a lot of us do is shovel snow in the winter.
Yep.
Unfortunately, that also leads to injuries. So
Yep.
let's talk about some of the injuries you're seeing.
Yeah, so a lot of people, they don't do, they're not real active during the summertime sometimes, and so then when winter rolls around, not only is it cold outside, but their muscles aren't ready to lift, several hundred pounds of snow over the course of a half an hour. So it snows 6 inches outside, and then all of a sudden you're doing this activity, and it's not something that you're used to doing for the last several months. So we see a lot of back injuries commonly because people just don't know how to lift that heavy load correctly. Less commonly, we don't see this, but people are actually suffering heart attacks. So it isn't even just a muscle strain.
Right.
It's they go out and overexert themselves, their body just is not used to it, and then they suffer some type of a cardiovascular event. So it's actually quite dangerous sometimes.
Or if you're like me, you want to get through it fast, so you take that really big scoop that you can barely lift.
Yes.
And probably shouldn't have.
Yeah, that's the most common thing.
Yeah.
Yeah, and then I know being an old man, sometimes those sudden motions that I haven't done in a while can lead to injuries. What are some of the ways that you're talking about all these things that could happen to you? How can other people kind of prevent this from happening?
So the main thing that we talk about is doing a warm-up. So sometimes people just roll out of bed and they're like, I gotta go shovel snow, so they just go and do it. You need to take a few minutes to kind of get the blood flowing a little bit, do just some body weight squats, do some arm raises, get the blood flowing a little bit, not necessarily stretch, but get it going that way. And then I like to talk about pushing the snow versus lifting it as much as possible. Most people think they need to like pick it up and physically move it. The best way to do it is actually use the shovel to push it along the ground. That's a much more powerful, better way of doing it. And then the second way is to just avoid lifting too heavy of snow at once. So you try to break it up into smaller portions. Of course, that lasts longer, it takes longer, but it's a much safer way of doing the snow shoveling.
Yeah.
Yes.
So I know that always happens to me. I realize that there's some muscles I forgot I had that remind me the day after I shoveled, after that first shovel. So because if you push the snow, eventually you do have to lift it up and get it off of whatever pavement. I'm a visual learner. Could you show me a couple of the things that I should be doing?
Yep, absolutely, yeah. So the main thing is trying to stay wide with your feet. So if your feet are too narrow, then you don't have the leverage needed to push the snow.
Okay.
So I tell people to always have a nice wide base in their feet.
All right.
That way they actually have the ability to use their hips. If your feet are
Okay.
too close together, the only place that your body has to go is moving and flexing through your spine, through your back.
Okay.
So that's the main thing we actually teach people, is really to use their legs better, and that usually starts with getting a wider base of support.
So spread and one foot in front of the others.
Yeah,
with the other
usually
things I saw you
stagger the
doing.
feet. As
Okay.
you're trying to push the snow in front of you,
Okay.
the worst thing you could do is try to push it to the side, because that involves rotating your body.
Yeah.
Good tip. Yeah, keep
Okay.
that base nice and solid.
Yeah.
And feel it just kind of practicing standing here, how much better that feels. So let's say we forget to follow your advice. Hopefully we don't, right? We're all going to do that. But if you do get injured, what's a good next step? What should we do?
Well, if it doesn't get better in a couple of days, usually your body's an amazing thing and it does kind of calm down and feel better. But usually in about a week, you want to go see somebody. So in Wisconsin, actually across the country, you can see a physical therapist like me without a doctor's referral. We're able to identify if it is a simple back injury and then help you with that, or if it is something a little bit more complex, we work with physicians across Madison to help get that better.
Okay, cool. And then one of the things I did see, a tagline that you have is "in the door in 24." So if for those of you out there that don't want to wait a couple days of being in pain and just want to get the answers right away, Kevin is willing to help you out. Kevin's located in Sun Prairie. Capital Physical Therapy has 6 locations around Madison, so pretty close to wherever you are, so that way you can get some help. So we are out of time. I know we have more questions that we weren't able to get to, but I appreciate you hanging out.
Thanks for
with
having
us.
me. Appreciate it,
Yeah,
guys.
thanks for
Yeah,
coming.
thank you, Kevin. We'll be right back with more Wisconsin Family right after this.